ITR is the Institute of Translational Research, and it was sponsored by the College of Education and Human Development to promote interdisciplinary research in the area of children's mental health, bringing together people from basic science and applied science to develop projects. And the projects focus on prevention, science, and treatment. It includes opportunities for early stage investigators to receive mentoring, and it invites investigators together to work collaboratively on projects. I think the merger of family social science with children's mental health is really kind of an innovative feature within this university involving this department. And as you can see, it kind of links my involvement with the Institute for Translational Research with family social science. And so what this really means to people interested in family social science is that the end goal is to study how the family influences children's mental health, because mental health is a critical issue in our culture today. Over 25% of children have or will have a mental health problem at some point in their life. So that's not trivial. And therefore, the department is moving to really contribute to that particular problem by developing infrastructure which involves education, training, and research that will prepare students for a career in that area. One of the things that I'm very much involved in is developing interventions that help promote better health. And within that context, obviously, parenting and other family influences are very much involved. Of course, and families and peers are two of the most influential systems. Families play a very significant role early in life, but give way to peers as children mature into adolescence, as you might expect. And so when you study those groups of children as they age, you have to consider the fact that, peers become much more powerful, influential in their adolescence, and your interventions have to incorporate that. Over the last several years, I've kind of stepped into an area called precision medicine or precision healthcare. For many, many years, intervention development was based upon one size fits all. It might be like going into a shoe store and you want to buy a pair of shoes and there's only size 9. Well, that's what it is. You either got to swim with smaller feet or you have to force larger feet into a size 9. And interventions were the same way. They had standardized components. Everybody got the same thing, the same dosage. Well, as you might expect, one standard dosage may not be in the best interest of everybody. Some people may need other things. And therefore, when we talk about precision medicine, we're looking at tailoring interventions to fit the unique characteristics of people. They have different risk factors and different challenges in their life. And therefore, as you begin to construct these interventions, you're looking at how we can fit this best to meet the needs and preferences of individual patients. So our work now, in terms of developing these, what we call preventative interventions, is to try to design these customized approaches that take into consideration the unique individual risk factors and promotive factors that are going to best serve individual people. The end product is something that hopefully will be more effective, more efficient, and more affordable. Well, within my own area of research, community collaboration has always been essential. We work with agencies where high-risk children and families may come to. That would include, juvenile diversion and corrections, domestic violence and family support, welfare and protection, international adoption, foster homes, family support centers, any place in a community that serves children and families who are in need. We partner with them in the research trials that we run and the interventions we implement, and their involvement and partnership is critical to that success. Because the long-term goal, of course, is to give them a product that they can incorporate into their own service structure. new and innovative ideas for how it might be better to do it a certain way. So partnerships are critical, community involvement is critical, and it's not something you can take for granted. The role of prevention science within the bigger picture of family social science. And we try to help students understand that there are various career pathways. So there is kind of a continuum that begins with basic science and moves all the way through to policy development. And people, depending upon their proclivities and their talents, will find a niche somewhere along that continuum.